The ischium forms the antero-inferior part of the hip bone, and it contributes to the 2/5 of the acetabulum. It has a body and a rami too. One superior and one is inferior. At a glance, it resembles the letter C, isn't it? So I'll be detailing these two parts over here in detail. Now, the main part of the ischium is the body. This is the thick and the most massive portion of the ischium, and that is why it is considered to be the torso of this interesting bone that we're discussing today. It has two ends, three borders, and three surfaces too. So let's discuss them one by one. The upper end basically is forming the posterior-inferior 2/5 of the acetabulum, as we know that the ilium, ischium, and the pubis are all contributing to this shallow depression over here, which is known as the acetabulum. The lower end forms the ischial tuberosity, and it is forming a certain angle with the body of the ischium, again contributing to the pelvic diameter. The ischial body has this projection, which is known as the ischial spine, that also makes a sciatic notch below. Now, this handle-like portion over here is known as the ramus. So we have three borders to the ischium: the anterior one, the posterior one, and the lateral one. So I'll be detailing these borders with you now. Now, coming to the borders, the anterior border forms the posterior margin of the obturator foramen, and the posterior one is in continuity with the posterior border of the ilium. The posterior border shows a projection which is known as an ischial spine, and it also forms a depression which is known as the lesser sciatic notch. The lateral border forms the lateral margin of the ischial tuberosity. Coming to the surfaces, the femoral surface lies between the anterior and the lateral borders. The dorsal surface is continuous with the gluteal surface of the ilium. From above downwards, it presents a convex surface adjoining the acetabulum. The ischial tuberosity is found on the dorsal surface and is basically a rounded bone that is extending from the ischium. It is located just below the ischial spine. Now, coming to the pelvic surface, it is rather smooth and forms part of the lateral wall of the true pelvis. We use a term, the conjoined ischiopubic rami, which is formed by the union of the ramus of the ischium, as you can see over here, and is basically fused with the pubic ramus that is found here. And both of these fuse together to form the conjoined ischiopubic rami. Now, the ischial bone gives muscular attachments to a very important group of muscles that basically forms the pelvic floor, the abdominal muscles, and the muscles that gets attached to the femur as well. So let's get into the details of these muscular attachments. The ischial spine provides attachment to the levator ani muscle, and this muscle is basically forming the pelvic floor. Lower margins of the sciatic notch gives origin to the superior and the inferior gemellus. Now, like the internal obturator muscle, the gemellus superior and the gemellus inferior help to steady the femoral head in the acetabulum. Both muscles also help to laterally rotate the extended thigh and abduct the flexed thigh at the hip joint by assisting the internal obturator. The femoral surface of the ischium provides origin to the obturator externus along the margin of the obturator foramen and to the quadratus femoris on the upper part of the ischial tuberosity. Now remember, both of these muscles are the external rotators of the thigh when the hip joint is in the extended position. Now, coming back to the ischial tuberosity, it gives origin to multiple important muscles. Superolaterally, it gives origin to semimembranosus, inferomedially to semitendinosus. Then it gives origin to the long head of biceps femoris, and the outer lower area gives origin to the adductor magnus. Now, as the name is indicating, it is the thigh adductor, which means bringing the lower limb close to the body like this. The pelvic surface provides attachment to the obturator internus. So here we have the important muscular attachments on all the surfaces of the ischium. There are also some important ligamentous attachments to remember. Two important ligaments are the sacrospinous ligament, which is running from the ischial spine to the sacrum, thus creating the greater sciatic foramen through which the lower limb neurovasculature, including the sciatic nerve, transmits towards the trunk area. Then we have this sacrotuberous ligament, which is running from the sacrum to the ischial tuberosity, forming the lesser sciatic foramen. Again, it is also transmitting very important neurovasculature. The lateral border gives attachment to the ischiofemoral ligament. Remember, all these ligaments are providing the stability to the hip joint, which is formed between the acetabulum and the femoral head. And it allows a range of motion to be performed at this particular hip joint. Now let's discuss the attachments on the ischiopubic rami. They're usually forming the pelvic floor or contributing towards the urogenital diaphragm. So they're supportive to the genitals. So let's get into the details of these muscles. The upper part gives origin to the obturator membrane. The lower border gives attachment to the fascia lata and to the membranous layer of the Colles fascia of the perineum. Now let me tell you, all these fascial structures are the condensations and they play a supportive function for the organs in the perineum and the muscles. The inner surface gives attachment to the urogenital diaphragm and to the obturator internus. Then in the middle, we have the sphincter urethrae and deep transverse urethrae. So it controls the urinary functions. Now you can observe that the names in the anatomy are self-explanatory. See, the names in anatomy are quite self-explanatory. As you can observe, we are using the word sphincter urethrae. So this sphincter is going to control the functions of the urination. Now, the lower portion of the ischial rami gives attachment to some very minute muscles known as the crus-penis, the ischiocavernosus, and the transverse perineum. So far, we have discussed the ischial bone. The ischial bone basically consists of the body and the rami. We discussed the anatomical landmarks that are found here and what are the important muscular attachments that gets their origins and insertions over here. So I hope that is clear to you now.